Thank you, Marion. Write your questions down. I'm sure you'll have a lot of nutrition questions. So our next speaker is Dr. Jonathan Wright. He's a professor in the Department of Urology at the University of Washington. He's a surgeon and a scientist, and he'll, I think, tell us a bit about what we should be doing with exercise. Jonathan.
Anyone need to make a phone call? Sorry about that. Yeah. The electronic challenges continue. So that's a great lead-in. Marion's talk about diet and the exercise as part of the PAL study, and I'm going to talk about exercise and prostate cancer specifically. And if my slides go out, I have them on my phone, so we can all huddle up around my phone and look at them. So we're well prepared here. So I'm excited to talk about exercise because we hear a lot about the different treatments that we have for cancer, radical treatments like surgery and radiation for early stage disease, and the medical therapies we have for advanced disease. But there are certainly things that you, the patient, can do that can also have a profound impact on the outcomes and your survivorship. Now this slide here just talks about the reduction in how exercise has been shown in many cancers to be associated with a lower risk of developing the cancer. Now we're here talking about those with cancer, but also prevention is important as well. And this is all the top cancers: colon, breast, bladder, endometrial, and gastrointestinal as well, renal cancer, kidney cancer, and there's prostate on the bottom. So across the board, regular exercise is associated with a lower risk of developing cancer. Now there's lots of benefits of exercise. Some of them are obvious, right? You do more exercise, you're going to have more strength, you're going to be in better cardiovascular shape, you're going to lose weight. Those benefits are obvious. But there's also other survivorship benefits as well. Quality of life has been consistently demonstrated to be improved. Both the physical quality of life, emotional quality of life have been improved. One's self-esteem. Anxiety is reduced. Study after study showing less anxiety for patients that are participating and doing lots of exercise. Emotional, cognitive functioning, and fatigue. Fatigue is a really big issue in prostate cancer, especially in advanced prostate cancer. Those patients in the room that are on ADT, that are on hormonal therapy for prostate cancer, are well aware of this. This was a study a couple of years ago that 40% of patients on ADT for prostate cancer had clinically meaningful fatigue, affecting their daily functioning. Not just, hey, I'm tired, but really interfering with their life. Exercise can counteract that. And it doesn't really matter what kind of exercise. Within the last couple of months, 2017 publication, this study looked at the different types of exercise. They randomized men on ADT to either cardiovascular training, so getting out there and doing brisk walking, those kind of things, or musculoskeletal training, doing lifting exercises, weightlifting exercises, impact exercises. And they also had a control group that they didn't do anything on, followed them. This was a 1-year intervention, and across the board, fatigue was improved. What these tables show here is that these are showing the improvements. The one on the left side is showing the improvement in fatigue scores for patients based on how much fatigue they started with. So each group, each of these 4 bars across the way, the bars on the far left are those that didn't report much fatigue when they started. Well, if you don't report much fatigue, you're not going to have much improvement in your fatigue because you're not fatigued. But the more fatigue patients had at the beginning, the more improvement they had with exercise. So the farthest group with the biggest bar are the most fatigued at baseline from their ADT and had the most profound improvement by doing 12 months of exercise. The table next to that is looking at the vitality, so it's the exact opposite. So those that had the worst starting point of vitality had the greatest improvement in vitality over the course of the 1-year intervention. Now, how might exercise actually improve against the cancer? Well, Dr. Neuhauser talked to some extent about that, how we don't really know how weight loss, diet, exercise improve cancer outcomes. And this complex slide here I'm not going to go through, but it's just to highlight there are many different possibilities for how, and it may well be more than one mechanism how activity and diet improve cancer outcomes. And the studies we're doing are to try to understand those specific mechanisms. But all of these things are definitely potentially working against the cancer and for you. Here's a couple of data looking at specifically in prostate cancer. These are two very large studies, 70,000 men in the top, 47,000 men in the second. Those doing more exercise had a reduction in the top slide of risk of aggressive disease, so a 30% reduction in the risk of having the higher Gleason score disease. The second study looked at those that had advanced disease, a 70% risk reduction in advanced spread cancer. That should be 30 MET hours, not 30 hours a week. It's a much lower amount of exercise that is required. What about those with cancer? So that was risk of developing cancer. What did look at men with prostate cancer? A couple of other studies, a few thousand men in these. The top one, walking more than 3 hours a week at a brisk pace, almost a 60% lower risk of disease progression compared to those who didn't walk very much at a much slower pace. Men with cancer, big reduction in progression if you're getting out and being active. That was looking at risk of disease progression. The second one looking at more vigorous activity, so not much. The first one's kind of in moderate. This is a more vigorous activity. You can see a tremendous reduction in the risk of prostate cancer-specific mortality. I like what Marion said about we need a prescription. We need to be able to write for our survivors to go and get exercise, get diet, and do like we do for cardiac rehab. But we need the studies. The PAL study is for men in low-risk disease on active surveillance. This is a study we're doing at the other end, and that's for men that have advanced prostate cancer. It's called the Interval Study, Intense Exercise for Survival Among Men with Metastatic Castration Resistant Prostate Cancer. And this is only an exercise intervention, trying to evaluate high-intensity aerobic and resistance training. So combining both, improving your cardiovascular and improving your strength as well. And this one, because it's an advanced stage, is able to look at survival as an endpoint and quality of life. This is an international study, 19 sites across the globe. Majority are international, because those places you can write a prescription and say, go get exercise, and it's given as part of their healthcare system. A lot of the sites are in Australia and the UK where they can do that. There's only 5 sites in the US, and we happen to be one of them. And that's because we have the resources here and the investment in both in people and space to be able to do this. This is our primary research team. Evan Yu, you're going to hear from later, medical oncology. He is in the room. He's our lead medical oncologist on this. Steve Plymate is a gerontologist and an expert in some of the mechanisms by which activity may improve survival, and he actually sits on the International Biomarker Committee for this. Ann McTiernan, some of you may know, she's an MD PhD here at the Hutch and has led for years a number of exercise interventions in women with breast cancer. There's tons of studies in women with exercise and diet. There's essentially none in prostate. And these 2 studies are going to help do that. Janet Stanford, many of you heard from before, a world leader in epidemiology of prostate cancer, is helping. Matt Van Dorn is an exercise physiologist who will meet with the survivors downstairs in that room that Marion showed a picture of earlier. He is also the exercise physiologist on this study. Kelly Crowder in the back over there, I see here, she has been instrumental in helping us get through this, through all the IRB requirements, which is a major hurdle to do this type of study in patients. The target is 900 men. As was discussed, as Marion discussed, we need a much bigger study to show a survival difference. And again, in the advanced setting, we were more likely to be able to do that. But this is 900 men, and we're looking at a number of different secondary outcomes as well, which include things like fatigue, like physical functioning, quality of life, symptomatic skeletal-related events. You know, ADT weakens your bones and weakens your muscles. So if we can strengthen your bones and strengthen your muscles with some of this impact training and the cardiovascular activity, we would likely be able to reduce the incidence of skeletal-related events as well. So who needs to be who would qualify for this? So these patients have to be castrate-resistant prostate cancer. Because of the advent and the use of abiraterone and enzalutamide, they've included a part of that as well. So patients can be on AbbVie or Enza and not progressing, or patients that have not received it yet and have evidence of the cancer progressing. Rising PSA, measurable disease on bone scans, They have to be medically fit to undergo. It's a pretty intense exercise, which is why, in part, no prior chemotherapy is included for this specific study, trying to really define the population that we're going to be looking at. But if you potentially are in this arena or know patients or friends that would, please let us know. We're very close to beginning opening and enrolling. This is a basic schematic. Patients, you will be randomized to either the intensive exercise or a control group. The control group still will get psychosocial support, mailings, and etc., and will take part in the in assessments throughout the 1 year. Over the first month, if you're in the intervention, it's intense. It's coming in 3 days a week for the exercise. Month 2 through 9, you're doing about 2 days a week coming in, and then it goes into where we try to get you more into a maintenance on your own, 1 day a week. So it is, the intervention does take over a month, over about a year to do. What about for everybody else? What kind of recommendations can I tell you now? These are from the American Cancer Society. Take part in regular physical activity, okay? Try to return to your normal activities as soon as you can after diagnosis and after treatment. I mean, part of our just natural response is to just kind of close in and sit in our house. We need to get out there and continue living. Don't let the cancer control you. You can control your life and move forward. You should aim to exercise 30 minutes of moderate to vigorous activity at least 5 days a week, and make sure a couple of these days are including strength training. Again, as we get older, we lose muscle mass. As we get older, we lose bone strength. Resistance training, weightlifting, Nautilus, that kind of stuff can work against that as well. Even simply jumping up and down, doing jumping jacks. This sounds kind of silly, but that impact actually really strengthens your bones and is one of the best things for improving your bone strength. Patients will often ask me, okay, you keep saying moderate activity. What the heck does that mean? Traditional forms, walking 3 to 4.5 miles an hour. You want to be able to walk fast enough that it's a little bit difficult to carry on a conversation or to whistle. Bicycling about 5 to 9 miles an hour. Other basic exercises, patients tell me all the time, I can't walk because of my knees and my hips, the arthritis that I have. Well, can you do yoga? And certainly, again, Nautilus, where you're going in and working on those rate training machines. Swimming is a fantastic activity if you have difficulty because of your joints. And there's fun things too. Even doubles, tennis doubles can count as moderate activity. Just don't take too much time when you're switching sides of the chat all the time. So, and there are other ways to get it too. You still need to be helpful around the house. So if you are pushing a power lawnmower, that actually counts as moderate physical activity. Note that a driver mower doesn't count. Okay, I have to have people say, "Well, I mow the lawn every week," and then you get a little further and they're in a driver one. That really doesn't count whatsoever. So, and lastly, I think a lot of us can relate to this, and that is that babysitting grandchildren is actually a moderate form of activity. This is listed on the U.S. Department of Health and Human Services webpage. So if you're pushing that kid around, or if you happen to have kind of those bratty kids that you have to chase, dress, lift into a car seat, that counts too. So improve your mood by working with your grandkids, and also improve your health. So I'll leave it with that, and I think, again, get out there and do it. And I'll ask you not to be this guy when you're going to the gym. Okay? Thank you.
Thank you, Jonathan.